When we talk about the breastfeeding, it is feeding a newborn baby. So breastfeeding a baby exclusively for the 6 month is really very important. Then after continued breastfeeding in addition to the appropriate solid food until 12 months and beyond is really very important. Now it is not only important for the baby, there are lots of benefits to the mother also, because if a mother they are doing the breastfeeding, it assists the uterus to return its pre-pregnant state faster, because there are lot many changes happen into the uterus during the course of the pregnancy. So if a mother will exclusively breastfeed to their child, so it will return the pre-pregnant state faster, and it can help the woman to lose the weight after the baby's birth. Lots of women they put on lots of weight after the parturition, so that weight can be controlled because of the breastfeeding. It reduces the risk of ovarian cancer and the premenopausal breast cancer. It reduces the risk of osteoporosis. Osteoporosis is a disease in which the bone become weak and become porous hollow like structure. So breastfeeding reduces the risk of the osteoporosis. It reduces the risk of mother with the gestational diabetes developing type 2 diabetes in the future. So these are the benefits to the mother, but the baby is also very much benefited because of the breastfeeding. It provides the immunity to the baby. Baby fed on the breast milk have a lower risk of gastrointestinal illness, allergies, asthma, diabetes, obesity, some childhood cancer, respiratory tract, chest infection, urinary tract infection, then SIDS, that is the severe immunodeficiency diseases, that is also called as a cord death. This is also cured. Breastfed babies are less likely to be hospitalized. Exclusively breastfeeding, that means no solid food, no formula food, even not the milk, or the water, for at least 6 months seems to offer the most protection. Now you can see one picture on my screen that is taken from the healthychild.com channel, one of my favorite YouTube channels. So in that, this Dr. Noor has given some additional benefit of the breastfeeding to the baby, that it controls the fever and cold, gastroenteritis, then respiratory illness, less diarrhea, less constipation, and strong immune system for the baby. So breastfed babies are very healthy. The main immune factor. Now, what is adding up the health? What are the health benefits and why the babies are getting good immune system, why they are becoming more and more healthy? A special type of the protein that is called as the immunoglobulin. Now these immunoglobulins are also known as the antibodies, which is naturally performed by our body. So children, this immunoglobulin have various classes, out of which immunoglobulin A, which is a secretory antibody which is loaded into the mother's milk. Now especially the first milk of mother, which is called as the colostrum. So this is loaded, it is having lots of antibody. That's why you might have seen each and every doctor is giving instruction to feed the baby immediately after the birth. So thereafter the mature milk also contains the immunoglobulin A, but it is having little lower concentration. This antibody is really very important because the baby is newborn baby, they do not have well developed immune system. So this antibody, that means mother's antibody, is guarding the baby against the invading germs by forming protective layer on the mucous membrane in the baby's intestine, even nose and the throat. Breastfeeding protection against the illness for the baby lasts beyond breastfeeding stage 2. It is not necessary that only 6 months the baby has been protected, thereafter they started eating their own food. Yes, after the 6 month also, if you are feeding your baby with the breast milk, they will be protected because they are getting lots of immunoglobulin from mummy. Studies have shown that the breastfeeding can reduce a child's risk of developing certain childhood cancer. Researchers even have documented a link between lack of breastfeeding and later development of the Crohn's disease and ulcerative colitis. Breast milk is really very important for the digestion purpose because it is easily digested than even the special formula feed. Hence, it serves a perfect food to promote healthy growth and development. Breastfeed baby, they will uh, get their food digested very well, so they will not get the constipation, they will not get diarrhea. Further, breast milk has no waste product. So waste product, that means each and every part or each and every ingredient, each and every nutrient of the breast milk is been digested, so that's why it does not leave any carbon footprint. So what are the nutrients of the breast milk? The most important, energy count. Now see, just now we have learned about the BMI. So I told you that the energy intake or energy count from each food is very important. So if a baby is taking 100 ml of mummy's milk, will getting 65 kilocalorie energy. I repeat, because this is important exam point of view also, student. If a baby is taking 100 ml of mother's milk, will get 65 kilocalorie energy. All right, so I hope you have noted it. It can be asked for the MCQ purpose. Now student, the nutrients of the breast milk may vary. If the mother is not taking the appropriate diet, the nutrient level may also decline. But ideally, breast milk contains, that means 100 ml breast milk, it contains approximate 1.1 gram of the protein, 7.4 gram of the carbohydrate, 3.4 gram of the fat, 28 milligram of the calcium. Negligible amount of iron is also present. Then vitamin A 137 IU is present. Thiamine is 0.02 gram. Riboflavin is 0.02 gram. Vitamin C is 3 milligram present in the case of the breast milk. Now see, this breast milk formula is made by many companies, but still they. So this is all about the breast milk. Now we can stop. Any doubt anyone have, or anything you want to ask exam?